Okay, I'm going to go ahead and get started. My name is Janet Gutierrez. I'm with Contra Costa Health Services, and I am an emergency planning coordinator and project manager for a lot of our COVID activities. I want to introduce to you guys to our team, Dr. Levin, who is logging in, and Christina and Ricky. Do you guys want to introduce yourselves real quick?
Hi, everyone. I'm Christina Ponce. I'm one of the public health nurses for Contra Costa County.
And I'm Ricky Rios Robinson, and I'm one of the public health nurses for Contra Costa County. Christina and I, as I told you last week, we've been the two nurses that have been going inside of our congregate facilities, those facilities like board and care, skilled nursing, and assisted living facilities to help assist them with potential COVID outbreaks or COVID outbreaks. Nice to be here.
Hi, and I'm Sarah Levin, Dr. Levin. I'm one of the deputy health officers at Contra Costa County, who's been working with the task force that's been addressing the infection prevention and control training and teaching in the congregate care facilities. And happy to be here with you with our amazing nurses who really have been doing the frontline work, and hoping that this caregiver training is valuable to the friends and loved ones and lay caregivers who are going into these facilities to provide necessary care for these residents.
So a quick introduction, I'll let Dr. Levin expand on it a little bit more, but today is our second module for our caregiver training. And thank you so much for all those who joined us for the second module and the first one. These modules will also be available online. Dr. Levin, if you want to expand on it a little bit more. And we also have a hand up in the audience. And a quick reminder, feel free to drop anything in the chat box throughout this presentation.
So I guess the only thing I have to expand on is that we developed these trainings in consultation in conjunction with the Association for Infection Prevention and Control, the national organization, with a generously funded grant from the National Association of City and County Health Officers. And we are really hoping that this is just the start of a new era where our local health jurisdiction and our public health endeavors will start to really recognize how important it is for us to address the healthcare needs and concerns within long-term care facilities for the elderly, who are some of our most at-risk community members when it comes to things like a pandemic starting. And we really want to figure out how we, as the local health jurisdiction, do a better job in supporting the health and well-being of the residents of these facilities. So all of you participating in this as caregivers is one of the first steps to doing that. So thank you for attending, and we hope you will share with other friends. This will be available online, as Janet said. So these kickoff meetings are really the idea of trying to start the spread and having our amazing nurses who've been doing the work with these facilities all along available to you for Q&A. So please put your questions in the chat. Please feel free to ask your questions at the end of the video presentation, the module, and we will do this again next week for our third one.
All right, I'm going to go ahead and share my screen and we'll start the module.
Christina, I can't hear anything on my line.
Let me take a peek. I can hear it on my end.
Yeah, I'm not hearing anything either.
Okay, hold on. Let's see.
And just back, I'd say back up. Yep.
Yeah, let's go to the beginning.
Sure. Yep, I restarted it. Let's see. Okay. Let me know if you guys can hear it now.
Hi, this is the second module in our family and caregiver training. Hopefully you have already watched the first module. We're going to build on that. This is about preventing the spread of infection.
Christina, can you expand the screen?
Now, I'm Nancy Paris. I'm a consultant in infection prevention and control, and I've had over 40 years of experience working in this field. I've worked in most healthcare settings, as well as many non-healthcare settings, and have participated in a number of activities, including investigation of several outbreaks over the years. Now, in this module, the objectives are that at the conclusion, you, the participants, will be able to discuss 5 ways to prevent the spread of germs, demonstrate proper hand hygiene technique using soap and water or alcohol-based hand sanitizer, describe the proper way to put on and remove personal protective equipment. Now, for those of you that did review Module 1, we went over some terms. I'm going to repeat them, especially the ones that are pertinent in this module. A patient, someone receiving medical or nursing care. A resident is someone living somewhere on a long-term basis. ADLs are activities of daily living, which include bathing, toileting, eating, dressing, and walking, and so on. Now, hand hygiene. And we're going to really get into this in this module. This is where we remove potentially harmful germs from our hands using either soap and water or alcohol-based hand sanitizer or hand rub, also called just hand sanitizer. Now, we also deal with organisms, or what we'll call them are germs or bugs. They're also a term that's used often as microorganisms as well. But in these modules, we'll limit it to organisms or germs. Now, when you see the term agent, that usually refers to germs. And in the context of these modules, that's how it's used. Transmission is how germs spread from one person to another. Contact is where you have 6 feet between you and another within 6 feet for more than 15 minutes with somebody else. And exposure is unprotected close contact with someone who is infected or an object that's contaminated. Precautions are what we take where we wear specific PPE, which prevent exposures to people with infections or infectious diseases, and it's based on interrupting the spread of those precautions. We'll get a lot more into specifically precautions with Module 3. Now, isolation also, it will be in Module 3. This is now typically used to when we're restricting a resident to their room. They cannot leave. And it's an old term that used to be used for precautions. Now it's more limited to talking about limiting them to their room, restricting them. PPE are personal protective equipment, and they're garments that we wear to protect from exposure to infected persons. And I'm going to go through this more in this module, and I'm going to emphasize now and later, this is equipment. It's not fashion. These are pieces of equipment that are meant to protect us, and it's important to wear them properly to be protected. Now, donning is a clinical term that means putting on and wearing your PPE. Doffing is taking off the PPE or removing them. And with regard to these terms, again, you may hear them in the healthcare setting, in the long-term care setting that you're in, by the staff, by professionals, by other people. And this is just so you're aware and you're familiar with what those terms may mean. And one of the things that was mentioned in the last module, and keep this in mind, if you're unsure of something, if you hear a term that you're not sure of, ask. There's no problem with asking. It's important for you, because of the role you're playing in that resident's life, to be aware and informed. So these are the 5 ways that we can prevent the spread of those germs. And I'm going to go through each one and what you need to know and what you can do. Now, as mentioned in Module 1, hand hygiene is the most important means of preventing spread. This is effective, it's easy to do, it's cheap, we can all do it. There's no reason not to. Now, hand hygiene prevents the spread of germs. Bottom line, we can use soap and water or the hand sanitizer, and we need to be aware of where our hands have been and where they're going. Where have they been? Have they become contaminated? Where are they going? What am I going to contaminate? Including avoiding touching your face, because we don't want to contaminate our mucous membranes of the face, the nose, the mouth, and the eyes by touching them with contaminated hands. Now, perform hand hygiene as necessary, as often as you need to, and do it properly. Keep in mind, gloves are not worn in lieu of hand hygiene. They never replace hand hygiene. That's a very important concept. So, Centers for Disease Control and Prevention said that hand hygiene is one of the best ways to protect yourself and your family from getting sick, and that is very true. It's been around for a long time, and it's something that we need to follow. Again, you can use soap and water or alcohol-based hand sanitizer, hand rub. But the technique and the timing is important for hand hygiene to be effective. If you don't do it right, if you don't do it long enough, it won't be effective. But we think it is, and that's really dangerous. So we want to do it right. Now, before I show you how to do it right, I'm going to tell you when to perform hand hygiene. So first and foremost, anytime your hands are visibly soiled, or if you think they're soiled, you need to perform hand hygiene. Go ahead and decontaminate them, clean them. After you've had contact with a contaminated or dirty environment, you need to perform hand hygiene. And this could be, for example, if you're helping the resident to the toilet, that's usually a dirty area. And so after contact with the toilet, you should perform hand hygiene. I've mentioned before touching the face, and again, I can't emphasize this enough, because other than breaks in the skin, this is where we end up exposing ourselves to germs by contact. And so it's with our eyes, our nose, our mouth. So keep your dirty hands away from your face. Just keep your hands away from your face, and you will remain protected. I'm going to talk more about the PPE and face masks, but after inadvertently touching your face mask or your face, you should perform hand hygiene. When you're wearing a face mask, or really any PPE, if you're touching it, it's considered contaminated. You've now contaminated your hands, so perform hand hygiene. In the last module, we went over a little bit about how handling and preparing food can be one way that we may contaminate the food and cause infections, cause germs to be spread. So before handling or preparing food, hands should always be cleaned. And actually, if it's handling or preparing, this is one of the instances where we should wash with soap and water. Hand sanitizer is not sufficient. And if we're feeding the resident, our loved one, hand sanitizer may be okay beforehand. It depends on the sort of contact you're having with feeding them. But when preparing or handling, absolutely soap and water. And another time when we absolutely use soap and water is after using the toilet. Wash your hands with soap and water after using the toilet. Do it properly. So, which do we use? Well, soap and water works by mechanically removing the germs. What this means is the friction that when we're washing our hands, we're removing those germs from our hands, and the soap actually helps lift the germs off of our hands. So we wash them down the sink. We're getting rid of them. We don't need special soap. You don't need to go out and buy special expensive soap. Good old-fashioned soap is appropriate, is fine. Doesn't need to be antimicrobial. Now, again, as I've said, soap and water must be used if your hands are visibly soiled. If you've been with the resident and they're having diarrhea, any diarrheal disease, or if you're also preparing food beforehand, this is when you must use soap and water. The hand sanitizer is not an alternative. Now, with soap and water, we must wash for at least 20 seconds. Otherwise, we're not being effective. We're not removing those germs. So you're going to think they're gone, but they're not. The alcohol-based hand rub works differently, but is extremely effective. What it does is it inactivates or kills the germs, but it doesn't remove them. So basically, you have dead germs. And it's important to do it properly in order to inactivate those germs. As I've mentioned, you cannot use it if your hands are visibly soiled or following contact with the resident who has diarrhea, or after you use the toilet or before preparing or handling food. Now, you can use the hand rub when you're unable to use soap and water. There are instances where a sink isn't readily available, and hand rub is really, it's great because it's portable. You can take it with you, and you can walk while you're sanitizing your hands instead of being stationary at one place. So it works well in the instances when we need to use it, and it's extremely effective. But never perform hand hygiene, be that soap and water or hand sanitizer, on or over gloves. If you are wearing gloves, and I will go over this a little bit later, but when you're wearing them, when you're done, you remove them and perform hand hygiene. Do not try and decontaminate the gloves. Do not wash them. Never, never, never. Okay, so how do we properly use soap and water to wash our hands? First thing is get your hands wet under running water. Now, a lot of people ask, what temperature does it matter? And it doesn't matter, except if the water isn't comfortable, you're not going to keep them under the water. So have a comfortable, warm temperature. If it's too hot, not going to be good. If it's too cold, it's not going to be comfortable. So have it nice and warm. And remember, we're not killing the germs with hot water. We are simply removing them. So the temperature is not important as long as it's comfortable. Now, after you've got your hands wet, apply soap and then lather up your hands, rub them together, and it's really important to cover all surfaces. You want to get the backs of your hands, the palms, between your fingers, and include your thumbs, and then under your fingernails, do a little scrub under them, get all the surfaces. And keep going for at least 20 seconds. And you all have probably heard the happy birthday song, which is what you can do to time yourself for at least 20 seconds. If you don't do it long enough, it's not going to be effective. Now, rinse your hands well underwater. You're washing all that soap and all those germs down the drain. And then dry your hands with a paper towel. Use that towel to turn off the faucet if it is a hand faucet like this. If it's a foot operated, you're fine. But don't recontaminate your hands by touching the faucet after you've nicely cleaned them. Now, hand rub is going to be similar, but there are a couple of differences. A lot of people think all it takes is a little squirt and they're done. That's not how it works. So this is extremely important to follow properly. Apply a squirt on the palm of your hand. Usually they say about a dime-sized squirt. Now, like with soap and water, we're going to rub our hands together and we're going to cover all surfaces. This is what most people don't do. And you want to cover the top, the palms, get between the fingers of both hands. Don't forget your thumbs and get your fingernails as well by rubbing the tips of your fingers against the palm of your hands. And you're going to keep doing that until your hands are dry. Now, if you haven't completed that cycle and they're dry, you need more hand sanitizer so that you can go through all of those steps. If you had too much and you've gone through that and they're still wet, keep rubbing. Just keep going through. You never dry your hands with a towel. Don't wipe them on your clothing to dry them. And you want to make sure that you keep going until they're completely dry. Otherwise, you're not. You're going to be recontaminating your hands. So you want to follow these steps with the hand sanitizer all the time. Now, one mention I'm going to make with the hand hygiene, and this also applies to wearing protective equipment that I'm going to go over, is that you may see doctors and nurses performing hand hygiene or putting on PPE, and it may be different from what I'm teaching you. The thing is, they may be doing it wrong. You now know what is the right way, and to protect yourself and to protect your loved ones, you need to do it properly and correctly. So the second step that we take is what we call cough etiquette or respiratory hygiene, a little bit of an official term there. But what this simply means is cover your cough, cover your sneezes. Don't cough into your hands. But if you do, you want to wash them afterwards. If you cough into a tissue that you're holding with your hands, dispose of it immediately in a waste receptacle. Don't set it on a surface. Don't set it on the counter. You're just contaminating things. But ideally, you'll cough into your arm, what they call kind of the vampire cough. I've seen people who think they're coughing into their hands and they're making a funnel where they're just blowing all their secretions through that funnel onto whatever surface. That's really bad practice and it contaminates the environment. So cover your cough, cover your sneeze all the time. That's good cough etiquette. Now, in addition, what we want to do is get annual flu vaccines because the influenza is a really important and dangerous respiratory infection. It's one that the strain may change every year, so one vaccine will not hold us for a lifetime. We need to get annual vaccines to protect us from each annual strain. But what's really important is the residents, our loved ones in these facilities are the most vulnerable population for many reasons. And we need to protect ourselves so we're protecting them, because the way residents in long-term care facilities become infected with the flu oftentimes is because of the visitors or the staff coming in who are not protected. So do your part, get the annual flu vaccine, and also we encourage all residents to be vaccinated. So make sure that your loved one is getting vaccinated. Now, in addition to the flu vaccine, you want to make sure that all of your vaccinations are up to date so that you're protected and you're protecting them. One of the infections that we saw an emergence of over the past few years was pertussis, and that was something where we needed to make sure that people who had been vaccinated years ago were indeed revaccinated. They got their boosters to make sure that everybody is protected and to prevent outbreaks. And then, of course, more recently, we have the COVID vaccine, which is important, and we will learn a lot more. We're learning a lot more every day in terms of what we need to do and what we'll need to do in the future. Now, the next way that we prevent the spread is with personal protective equipment, or PPE, And it may be necessary for contact with your loved one, with the resident. Now, this will be explained a lot more when we need it in Module 3. But the important takeaways here are that, again, this is considered equipment. You need to use it properly in order to be protected. That's what it's there for. If it is required, there will be a sign posted indicating what you need to be wearing, or in some of the long-term care facilities, there may not be a sign, but it may be where you will be told what may be necessary. And in many facilities, it will be available at a cart at the entry to the room, or again, somebody will explain to you where you can get those that personal protective equipment if you need to be wearing it. Now, again, this is one of the instances where you may see caregivers, professionals that are not exactly following what I'm going to go through in the next number of slides, but you need to do it right, because that's what will protect you, and that's what will protect your loved one, your resident that you're caring for. So, first of all, wear only what is needed for the task. What you're being told to wear or what you know you need to wear, don't add to what you're being told, because that can actually cause more of a problem, more exposure. And one good example is this. A lot of people get concerned about their shoes, the bottoms of their feet, or the bottoms of the shoes. The floor is always considered dirty. We walk along floors, they get cleaned, but we consider that the bottoms of our shoes are dirty. We don't put them on beds. We don't put them on the resident furniture. We keep them on the floor. So some people seem to want to wear booties. That actually doesn't create any protection, because those booties are going on the dirty floor, and your shoes are not going to be going on the resident's bed anyway. But the danger here is that putting them on and taking them off, you're actually touching the bottoms of your shoes, or risking touching the bottoms of your shoes or the floors, which is now where you're going to contaminate your hands. You normally aren't going to be touching your shoes, so you're not going to have any problem. But this is where, by adding something that's unnecessary, you're actually creating a little bit more of risk. Now, put on and remove all PPE carefully and properly to avoid self-contamination, which I'll go through. Discard properly immediately after removing, and always perform hand hygiene after removing your PPE. So what do we wear? Most commonly, we wear gloves. And what these do is they provide a barrier between our skin and blood, body fluids, and a contaminated environment. Now, one of the times that you can make a decision to wear them is if you think you're going to touch contaminated skin or a contaminated environment. Then gloves are appropriate to be worn. In this instance, there will not necessarily be a sign telling you. Now, we perform hand hygiene before putting on the gloves and after removing. This is important, because think about this. When you go and grab a pair of gloves out of a glove box, you're assuming that they're clean. And that's because everybody has performed hand hygiene, or should, before going into that glove box. If somebody's hands are dirty, they're now contaminating all those gloves. So be conscientious. Perform hand hygiene before putting on the gloves and before reaching into the glove box. Now, once you put them on, we consider them to be contaminated the moment they go on your hands. And it's simply a good practice to remember, because that way you will avoid contaminating people or objects once they do actually become contaminated. So they are considered single use when you put them on. When you're done with whatever it is you're doing for which you need them, you take them off and dispose of them. Do not double, triple, quadruple glove. There are some people that it's like peeling an onion. They put layers on and just take one off at a time in order to avoid hand hygiene. That is really bad practice, and it's really dangerous. And I don't even know how they get that many pairs of gloves on. Don't wear more than one pair at a time. And again, when you're done, remove them and discard them into the trash. And you want to change them after resident care and between activities. So, for example, if you're helping with your resident use the toilet, after you finish with them in the toilet, if you're needing to wear gloves, you remove the gloves. And if you need another pair on for another activity, then at that point you perform your hand hygiene and put on another pair of gloves. The other thing is you never walk out of the residence room wearing gloves. You never reach out of the residence room wearing gloves. If you glove and then you realize that you needed to get something from the nourishment room or the kitchen, you unglove and then you perform hand hygiene, leave, and then come back and start all over. So how do we remove gloves to prevent contamination of our hands? So remember, the outside is considered contaminated, and we need to be very deliberate and very careful so that we don't contaminate our hands, or we do it as minimally as possible. So the first thing is you want to pinch the outside of one of the gloves near your wrist, and then you're going to peel it off, turning it inside out, and then ball it into that gloved hand. Now, you're holding in your fist, as you can see in this picture, she's holding the glove, and she's taking her now ungloved hand and having two fingers, you could use 1, 2 fingers, slide it under that glove and be as careful as possible not to touch the outside of the glove, or if you're wearing a gown, the outside of the gown with your bare hand. Touch as little as possible. When you touch inside to inside or with your bare hand, that's clean to clean. And then you're going to also, again, peel off the glove inside out, as you did with the other. Now, discard both of the gloves into the trash receptacle. You'll have them balled into one neat little ball in your hand, and you want to simply discard them. Don't fling them, throw them, don't set them on a surface and wait for later. Just discard them into the trash and then perform hand hygiene immediately following. Because if you have contaminated them, even minimally, you will then eliminate those germs. Now, the next most common PPE or piece of equipment you may need to wear would be a gown. And what this does is it protects your clothing from contamination, from droplets, splashes, or sprays that come from the resident. So if you're anticipating any sort of a splash of blood, excretions, secretions, anything else with whatever you're going to be doing, then that's where you want to wear a gown. In addition, if it's on a sign because of precautions, which again, this will be in Module 3, then there are instances where you need to wear a gown, but otherwise, when you're anticipating, you can put on a gown. Now, when you put on the gown will have two ways that we wear it. Some have a strap that goes over the head, and it's called a breakaway gown. The other will have a tie at the neck. Both of them will have a tie at the waist. So put it on. If it's the breakaway, put over the head first, then tie the waist. If it's got two ties, tie the neck and tie the waist. Make sure that you tie both of them. Now, again, once you've got it on, we consider the outside to be contaminated. And so we want to take care and avoid not touching the outside of the gown. They are considered single use only. So when we're done wearing it for whatever activity we need it for, we remove it appropriately and discard it. If it's a disposable gown, we discard it into the trash. If it's a reusable gown, we discard it in the linen hamper. And then we perform hand hygiene after removal. Now, as with gloves, Gowns should never be worn outside of the residence room. And again, if you forgot something and you've just put on that gown and technically you haven't had any exposure, we still consider it contaminated. You need to discard it. You need to remove it, perform hand hygiene, to leave the room. So it's good to try and plan what you are going to be doing and have everything that you need before going in the room and putting on the personal protective equipment that will be necessary. So don't ever wear it outside of the room. Really important to remember. Now, removing the gowns to prevent contamination can be a little bit tricky, so you want to watch this carefully. First thing is you will remove your gloves first and perform hand hygiene. Then you will untie both ties. Now, if it is the breakaway gown, you will first tug it gently at the neck, not really hard, but tug it so that it will break away. Don't roll it over your head. Never roll it over your head. But many of the gowns will have the ties. So you untie, and then you start with your clean hands that you put just under the neck. And that's, again, you're clean to the inside of the gown, which is considered clean. And you roll it a little bit off the shoulders. Then, using your hand to the inside of the gown, you roll it inside out over one arm. Then you take the other hand, and once you've unrolled it off of the one arm, you take that hand and unroll the other arm very carefully. So you're rolling it inside out into a ball. Again, take care to avoid touching bare skin on your hands or your arms with the outside of the gown. Hold it away from your body as you do this so that you just avoid any contamination of yourself. Roll it into a ball and discard it into the trash receptacle or the linen hamper, whichever is appropriate. The reason for rolling it into a ball is just keeping it tight and compact so that we don't want parts of the gown flung around, because then again, we have more of a risk of exposure or contamination to ourselves or to the environment. And with a little practice, this becomes pretty easy. Now, we never throw the gown. We're not playing basketball. Don't try and fling it across the room in the trash can. Discard it into the proper hamper right by you. Now, face masks, or what we're calling coffee filters. Everybody has been used to wearing face masks because of COVID. And for a period of time, and perhaps in the future, universal masking may continue or may come up again during flu season. But there are instances where when we're not universal masking, we will be required to wear a face mask. And during all of these times, you want to use them properly. Now, the face masks protect the mouth and the nose from droplets. And we perform hand hygiene before putting on face masks, because remember, we're going up toward our face. So our hands should be clean. And in certain instances where we're not doing universal masking, if you anticipate splashes, droplets coming from the resident, then that would be appropriate to put on a face mask. So when you're putting it on, make sure to tie all the ties properly if it has ties. Some masks have 2 ties. Many of them have straps that go around our ears or behind our head. You want to put it on completely. Don't leave one of the straps hanging. Don't leave the ties untied, because if you do that, it's not protecting you. Now, face masks should always cover from nose to chin. And when you put on the face mask, you want to wear it properly, make sure you've got a good fit. And part of the way you do this is put it on around your ears. And then if it's a medical type procedure face mask, not a cloth, they have a little metal piece at the nose, pinch it to get a good fit. Once you've put it on, as with everything else, the outside is considered contaminated. Do not touch it. And don't touch the inside either, because whatever secretions you have are contaminating the inside. So keep your hands off of everything but the straps or ties. Now, these are single use only except for cloth masks. Cloth masks can be reworn, and I'll get into a little bit more information about them. Now, when you're removing face masks, only handle by touching the ties or the straps. Don't remove them by touching the face. Untie or remove the straps from your ears or your head, and then discard the mask into a trash receptacle and perform hand hygiene. Or if you're using a cloth mask, put it into a bag to take home and wash. So I'm going to go again over proper use of face masks. And what I'm going to tell you is everybody has been wearing face masks during the COVID period. So a lot of experiences out there, but there is a lot of improper use. So again, this is what's proper. And you're going to see caregivers, people who are nurses and doctors and other professionals wearing face masks improperly. You need to do it properly. That's how we protect ourselves. So always put on by the ear straps and ties, and then pinch the nose for a fit if it is a procedure or medical type face mask. Always cover nose to chin. Make sure you've got a proper fit. If you don't have a proper fit, first of all, it's not protecting you. But more importantly, or maybe just as importantly, you're going to keep fussing with it to try and get a better fit. Now you're contaminating your hands. You want one that fits well to protect you and doesn't need to be manipulated while you're wearing it and is comfortable. Now, always remove by touching the ear straps or the ties. Don't touch the face of the face mask, the front or the inside. If it becomes soiled or damaged, discard it. With a cloth mask, of course, you'll wash it. But if it's a disposable mask, once it's soiled, get rid of it, even if it's in the middle of a day and you're still wearing one. If it's a cloth mask and it becomes damaged and the straps aren't working any longer or they're not giving you a good fit, get rid of it as well. We need to have, again, this is equipment and it needs to be working properly to do its job, which is protecting us. Now, always wash your cloth masks after every use. And by every use, we mean if you're wearing it during the day to take care of the resident or your loved one, at the end of the day, wash it. Don't wear it the same one day after day after day. Keep it clean because you're destroying any organisms, any germs that it's contaminated with. Now, regular laundry, a washing machine where you've got your high temperatures and a dryer with the heat, that will get rid of the any germs it's contaminated with. And so it's a good idea to do that, to wash it that way. If you don't have the benefit of a washing machine and you're washing them by hand, then what you want to do is make sure to use soap and water, clean it thoroughly and let it thoroughly dry, and then leave that mask for a few days. Don't wear it again for a few days. Rotate your cloth masks. Again, perform hand hygiene after handling the face mask, always. Now, this is what you cannot do, what is not considered appropriate wearing a face mask. These are not personal protective equipment. They will not protect you. Neck gaiters, no good. A bandana, no good, for the same reason as a neck gaiter, because we're not getting, first of all, a good protection from the cloth, and we have open areas. We don't have a good tight fit. This one makes me really crazy because a mask with a respirator valve, what's it doing? This person feels like she's being protected because she thinks it's keeping things from getting in that mask, which it isn't necessarily, because if there are other open areas, droplets may be getting in. But more importantly, whatever she's got going on, she is spewing it right out of a funnel into the environment, into anybody's face that she's around. So those are not protective and they should not be worn. and considered personal protective equipment. Now, I love my bling just as much as the next person, but bling is not equipment. Face masks with sequins should not be worn. This is not fashion. This is equipment. And the problem with sequins is that in order to have sequins in a fabric, they're sewn in. And so they're tiny holes. Now, those holes to us look little, but those germs are even smaller. So this gives the perfect opportunity to have germs get through that mask, and they are not safe for either person. They're not safe protecting us from what she has, and they're not safe for people that person may be exposed to. So please, no sequins or any other perforations. A face mask, if it is not a healthcare type face mask, those medical or procedure masks, should be at least 2 or 3 ply. It should not be a thin fabric like muslin, and it definitely should not be sheer and a netting like this. This may be a fashion statement to her, but it's absolutely not protecting anybody at all. It is not equipment, personal protective equipment. And then last of all, any face mask that is ill-fitting, if it doesn't fit well, it's not protecting you. So whatever it is, you need to make sure it fits well. And if it doesn't, adjust it or get another one. Now, with our face masks, again, the outside is considered contaminated. So the way that you can avoid contamination of your hands, which ultimately may cause contamination of yourself, you may touch the environment or your mucous membranes. This is what you need to remember. Do not touch your face mask when it is on your face. Don't wear it under your chin. That's not a resting place or a holding place for the face mask. If you need to remove it and discard it. Or if it's cloth, store it properly, but don't wear it under your chin. And remember, nose to chin. If you wear it under your nose, it's not protecting others and it's not protecting you, and don't wear it anywhere else. That's not accomplishing anything. Now, don't put any perforations in it whatsoever. And there was a company that came out with masks with holes in them, little flaps for eating through. That makes no sense because when you affect the integrity of the mask, it provides absolutely no protection. Don't try and eat or drink through it, go around it. You're disrupting the protection it's giving you. Don't do it. Now, never try and disinfect a face mask. Now, that's a little different from a cloth mask because those can be washed, and if you need to use bleach on it, that should be fine. But with these disposable, don't disinfect them. First of all, you're not accomplishing anything. Secondly, and again, most importantly, you're affecting and destroying the integrity of that face mask. So it's not going to work. And you don't want something that won't work, especially when you think it's working. Okay, pop quiz. Which of these is the correct way for you to be wearing a face mask? A, B, C, or D? And I think everybody got this one right. This little pup is wearing his face mask properly, covering the nose, the chin, it's over the ears, it's fitting well, and it's proper. Okay, a little bit more about face masks. And this is just so important because this is something that we've worn a lot during COVID. A lot of people have been wearing them and handling them improperly. And in years to come, we may see more universal wearing of face masks during flu season and so on. It's a possibility. So make sure your face mask fits snugly and properly. Don't touch it when it's on, or if you do, perform hand hygiene. Wash cloth masks after every use and perform hand hygiene. And treat your mask like your underwear. Do not touch it or adjust it, especially in public. Do not borrow or lend. Make sure the fit is tight but comfortable. Make sure it's clean, at least daily. wear the right side out. If it's stained, throw it away. If it's damp, change it and don't go commando. Okay, I'm going to talk a little bit about protective eyewear, which includes face shields, goggles, and safety glasses. And these are worn to protect our eyes from droplets, which can occur from somebody sneezing, coughing, and not covering. And there are, this is something that will be less needed and worn by you, but there may be instances, and again, this will be in the third module, where you need to be wearing protective eyewear. So just like with everything else, you perform hand hygiene prior to putting on protective eyewear. A good thing to remember is anytime you go above your shoulders, make sure your hands are clean. So here you're going to be going over your shoulders. Now, when you put on the protective eyewear, you want to adjust for a proper fit. So if you need to adjust the straps or headband, do it ahead of time. Do it right when you're first putting on that protective eyewear, because you don't want to have to go back. You don't want it falling off your face or too tight and being uncomfortable and where you have to adjust it. Make sure you've got a good fit, a good secure fit. Now, we don't wear it ever on top of our head. Our heads are not places where we keep and store our protective eyewear. And one of the things I'll mention here is I mentioned the type of protective eyewear, one of them being safety glasses. They're considered protective eyewear. They are my least favorite, but if that's what you have available, by all means use it. But this is what happens. A lot of people look at them kind of like sunglasses, where we prop them up on our heads when we don't need them. The problem there is each time you do that, you're contaminating your hands and probably not thinking about it. So they're not as good as goggles or a face shield. But if that's what you have, by all means, use them, but don't wear them on top of your head. Now, we're not going to touch the front of the protective eyewear. Again, it's considered contaminated once we're wearing it, because we're wearing it to protect our eyes from droplets. And we're going to assume they're on that face shield or goggles or those safety glasses. Now, if you need to wear them for a particular situation that with the resident, and you need to wear them all day because of the type of precautions that your resident is on, it's okay to rewear them for the entire shift. And you can wear them, actually, you can rewear them. This is one type of personal protective equipment we can rewear. But what you need to do is when you remove it, you need to handle it properly, clean it, disinfect it, store it properly. Have it labeled with your name so that you know that that one is yours and you will be the only one wearing it. Nobody will wear yours and you won't wear someone else's. And you will know how you handled it to make sure you don't contaminate yourself when you're putting it on later. Again, perform hand hygiene when you're removing. So here are the steps. So when you're putting it on, what she's done here, you can see she's putting the strap over her head. This is with a pair of goggles, and just putting it on, making sure it's comfortable, and then not handling it any further. So now with removing, it's going to be the opposite. Handle by touching the straps only. Don't grab the front of the goggles. And if it's the safety glasses, you'll touch the temple pieces, but never touch the front of the protective eyewear. Now, we always disinfect and store properly for reuse. We start clean to dirty. The inside is considered clean because it wasn't exposed to droplets. And so we start there, disinfect the inside, and then disinfect the outside of the protective eyewear, and then store it properly. That may be in a breathable, such as paper bag. And if it's for you, for your reuse, again, label it, label the bag. and the facility will tell you where it's appropriate to store it. Now, a few reminders, just revisiting personal protective equipment. Always wear the proper PPE for the situation and wear it properly. If you have it hanging in any way, it's not proper and it won't protect you. More is not better. Wear what is necessary. If you try and add more, you're just going to confuse things and you risk self-contamination with what you're adding. So don't wear more. Ensure that proper fit of all PPE. Here he's pinching the nose, going under the chin, make sure everything fits properly. That's the only time you can touch the front, by the way, when you're putting it on. And then never, ever, ever, ever leave the resident room wearing any PPE. You want to discard it first, perform hand hygiene, and then leave for whatever reason you need to leave. A few more reminders. Don't ever try and clean or disinfect these procedure masks. Again, you will wash and you may need to disinfect your cloth masks. Then any PPE that is soiled and damaged, and this is face masks, gowns, anything else, even the face shields and goggles, if they're damaged, then you will discard them. With eye protection, if eventually it becomes, a face shield can get kind of bent, or it could get the visibility may be impacted, scratched, in which case you can't see clearly. If you can't see well through it, it's damaged, you need to discard it at that time. Now, again, put on and remove all PPE properly to avoid self-contamination. And as you keep hearing, always perform hand hygiene before, putting on, and after removing all PPE, because that, again, protects you from any potential exposure that may have occurred. Okay, the next step is avoiding contact with sick people. And that says, thanks for coming to work sick and spreading all your germs to all of us. We don't want to do that. Now, this little cartoon on the side is really helpful because it does show the ways that we end up spreading those germs, which was talked about in Module 1. So the first one, you can see here's a mouth, eyes, and nose. That's how those germs get into our bodies, or through broken skin, if you recall. So by those droplets going in our face, that's one of the ways that spread occurs. The second one is where we contaminate our hands and then contaminate someone else's hands, and then they put their hands up to their eyes, their nose, mouth, and expose themselves. Or third one, contaminating the environment by coughing on it without covering the cough. And then somebody touches that environment and then again exposes themselves through their mucous membranes. So what you need to remember here is, if you are sick, stay home. You are important. Your time as a caregiver or a family member is so important to the resident, but you are not helping them if you come to care for them or see them when you are sick, and you're not helping yourself. You need to stay home and get well. Now, also, check with the facility to see when it is okay to return back to the facility. One of the things you need to remember is that you don't want to go by what your personal physician says. While I understand they have knowledge and I respect what they say, the situation is they don't know what is the policy of the facility, and you need to abide by the policy of the facility. Remember, rules and regulations. So make sure the facility clears you to return to their facility. Now, you also want to avoid contact in your at-home time or you're out and about. Avoid contact with persons who are or might be sick. So one of the ways is, if you have someone you live with who has been sick or is sick, try and keep them separated from yourself and from others in your household to prevent those germs from spreading to others and to you. Keep the surfaces clean and disinfected so that if they have contaminated any surfaces, you're being protected from exposure from any germs on those surfaces. And wash your hands or use hand sanitizer after handling any of their waste, their linen, any surfaces or items that may have touched and spread the germs to. So keep that in mind to stay healthy, stay well, and not bring any germs in to the resident. And then a little bit more on cleaning and disinfecting the environment. So you want to keep your home clean and disinfected as appropriate. And also the residence area, keep it clean. And the facility, most facilities will have some process and for doing routine cleaning, although you may be asked to help with some of it. Now, keep in mind the frequently touched surfaces. And so that could be the bed, it would be the toilet, it could be a phone in their room. So look at the surfaces they're touching a lot of the times, and those probably need a little bit more frequent disinfecting. Now, we always clean before we disinfect because we want to reduce the number of germs on a surface by removing them manually with cleaning. But the other thing is, if there are germs there with any sort of, like if there's saliva, if there's any blood, if there's any body fluids, secretions, that even if we don't see them very well, there are germs there, and the disinfectants most of the time will not be effective with those body substances. So we clean first and then we disinfect the area. Now, you want to make sure the disinfectants are compatible with any surfaces. And in the nursing homes, at that level of care, the facility will have determined what disinfectants they have and what you will use. In those instances, please don't bring in any other disinfectants. Use the ones that they have and that they provide, because they know what's compatible and they have a process. Now, going to the lower level of care, board and care, the custodial board and care shelters and so on, in those sort of situations, they may not have disinfectants with a protocol, and they may allow you to bring in a disinfectant. If you do, what you want to do is first check with them to see what their expectations are. But regardless of whether it is one that you bring in or one that they provide, you always, always, always follow the instructions for use that will be on the disinfectant label. One of those pieces of information will be to keep the surface wet for the full contact time indicated on the disinfectant. And that means that if you spray an area or if you have a wipe and you wipe down a surface and it says a 5-minute contact time, you need to make sure that it stays wet for a full 5 minutes, because if it doesn't, then you're not destroying those germs. If you leave it for only 2 minutes, it's not effective. So keep it wet for the full contact time. Follow the instructions very carefully. Wear gloves to protect your hands. And a couple of mentions here. Bleach is used a lot as a disinfectant. It's very, very good. It has a few concerns. One is it's not compatible with stainless steel. So you just want to be aware of that and not use it in any kitchen areas that have stainless steel surfaces. It will destroy them. The other thing, though, that is really important when it comes to following instructions properly, full strength bleach is not appropriate for disinfecting. The fumes can be very disruptive, very concerning. They can cause allergic reactions, watering of eyes, and and things like that, but it's not healthy for us. The bleach needs to be diluted to a certain amount. So if you're ever using bleach, make sure to know what is the proper dilution, dilute it properly, and use it that way. People think a full strength is going to kill everything, but it may actually not be effective. So use bleach carefully, properly, and also with that, you're going to wear gloves as well. But always follow all the instructions for use. And what you want to do is look at, here's an example of a label, and just to reiterate, this is one from a spray, a disinfectant spray, and it's a little hard to read, but this is from an actual disinfectant. And it says to disinfect, heavy soil must be removed prior to disinfecting. So remember, clean the surface first, and then hold the can upright 6 to 8 inches from the surface. Spray until thoroughly wet. Let stand for 5 minutes. That is this 5-minute wet time or contact time. If it dries at 2 minutes, spray it again. The total time needs to be 5 minutes. You don't have to keep starting the clock over again. But make sure it stays wet for at least 5 minutes. Then it says here, allowed to air dry. We don't wash off or rinse off a disinfectant from a surface unless we are specifically instructed to do so. Usually we let it air dry. If it's more than 5 minutes or whatever the contact time is, that's fine. Got you covered. So, in summary, keep in mind that you need to wear PPE properly when it's needed to prevent the transmission of organisms or germs. Wear what you're told to wear it properly, and you want to follow proper practices in actually wearing it and removing it to prevent from additional possibilities of exposures and self-contamination. And I talked about hand hygiene. I like to say it forgives all sins, because anytime you may have contaminated your hands, which are aside from droplets right in your face, that's the time you're going to risk exposure to germs. Hand hygiene covers you there. Doing it properly and doing it anytime you think you need to will protect you from any possible exposure. And that is the end of Module 2. Thank you for your attention.
All right, so that was the second module. Ricky and I were going to, let's see if we have questions in the chat. I don't see any questions. So Ricky and I were just going to demonstrate. I'm going to do a surgical mask, and Ricky's going to show everybody how to properly put on and take off gloves. So for a surgical mask again, ooh, you can't see it. I'm going to go ahead and do hand hygiene first before I touch my mask or my face. So you just want to make sure you're getting all of those surfaces in between, like she was saying. All right, and now I'm free to grab my mask. So again, I'm going to take it by the ear loops and hold it up, tuck it behind my ears. My hands are clean. I can go ahead and adjust my mask. I'm going to pull it under my chin and pinch the nose so it looks like this. So it's completely covering my nose up to the bridge of my nose, and it's under my chin. Okay, so at that point, I'm going to go ahead and hand hygiene again. So I know my hands are nice and clean, and I can go ahead and start caring for the resident that I'm in the room with. Ricky's going to go ahead and show you how to put on and take off gloves.
Okay, so you may find yourself in a situation where you actually may need to put on gloves, and that could be an instance where you're providing care for your loved one, and you anticipate that you may come into contact with bodily fluids. I can't stress enough, just like you heard in the presentation, hand hygiene is so critical. It's the #1 way that disease is spread. So always remember to wash your hands. When all else fails, the #1 rule in nursing school, if you don't know the answer, our instructors always told us, wash your hands. So we just want to make sure that when you know how to put on your gloves and when it's appropriate to wear your gloves. I know that you've probably noticed in public sometimes, Christina, I know you've seen this too. People are at the grocery stores with gloves on their hands. And this is the absolute worst thing that you can do because essentially what you're doing is you're touching germ after germ after germ, and then you're touching your cart and you're touching, you know, boxes of food, and then you're touching your face, and then you're at the register. I mean, it's not doing anything. If anything, it's making the risk of contracting a bug or disease much greater. So during the presentation, she talked about how to properly put on and take off gloves. Again, always when you're going to put on gloves, you want to perform hand hygiene. So I'm demonstrating that here. We'll just pretend that I have it. You want your hands to be nice and clean. You want to go ahead and I hope you guys can see this here. I'm going to go ahead and put one side on. Can you see that? Hope that doesn't look too silly. And then I will go ahead and put the other side on. Okay, and so once the gloves are on, it's important to remember that gloves are for single use only. So you're going to go in, and if you're providing care for your loved one, you want to make sure that when you finish that you take off your gloves and perform hand hygiene. Don't get distracted and start doing, you know, multiple other tasks. So again, gloves are single use only. So once you have your gloves on, you want to provide care. And I hope you can you see that? Okay.
We can see it.
This is the trick. Hopefully I do this all the time in the hospital. I hope I don't forget how to do this now that I'm on Zoom. But what you want to do is you want to start by taking one of your gloves off. So I'm going to just start with this side. And what you carefully remove it and you ball it up. So if you can see that there, it's in my hand. And then you want to get your other hand and you want to come underneath and you want to just pull it over just like that. And then you want to carefully discard the gloves in the trash can and then perform hand hygiene. That's how you do it. Again, the most important thing for us where we've seen facilities that have had some problem, we almost always can point it back to hand hygiene and improper use of gloves. We see gloves in the hallway. That's something you never want to do. You want to put hand hygiene, put the gloves on, provide care, single use only, take them off safely, throw them in the garbage, and then clean your hands. And that's it.
Perfect. And now, since we did all of our care, it's time to take off your mask. So again, you're going to hand sanitize before you touch your face or the mask. And remember, now the outside of your mask is considered contaminated. So when you go to remove your mask, you want to grab from the loops in the back and you want to pull directly away from your face. So the outside of your mask had no chance to touch any part of your face. So now I'm going to go ahead, I'm going to toss my mask, but now I touched my mask again. So hand hygiene again. So your hands are nice and super clean now. So I've hand hygiened again, and now I'm free to leave the building. I hope this helps everybody. Let's see, still no questions. No questions for anybody, huh? Let's see, Dr. Levin, should we try to take them off mute again to see if by chance they just can't use the chat?
Sure, that sounds good. Give it.
Let's see, Mary, are you able to remove everybody's mute?
Let me see if I can.
Okay. I don't think I have the option on mine.
basically make some panelists, and then I gotta unmute them all.
Okay.
So if we want them to speak, I need to promote to a panelist because this version of Zoom.
Okay.
Let's just speak, let me know and I can promote.
So there is a question in the, can you use the mask from room to room?
So using the mask from room to room, if this is a staff member, they do use their mask. You would not want to touch your mask. Again, hand sanitizing. Gloves and gowns are single patient only. So even if they have a roommate in their room, you can't go from, bed A to bed B with the same gloves and gown on. You need to hand sanitize and put on a new set in between all residents.
And then if you're a caregiver and you're at a facility and you're visiting a loved one, the gown, the mask should typically be single use only. So when you leave, you want to discard that mask just because you've gone inside of the facility. So yeah, so if it's you wouldn't want to go if you're visiting someone, you want to go from one place to another. Single use only.
So again, mainly staff use the same.
Yeah. Yes, Christina's correct. So to clarify, if it's staff, they don't change out their surgical mask between residents. However, if you're a caregiver and you're going inside a facility to visit a loved one, your mask would be for single use only.
Correct. Hopefully that makes sense. Any other questions?
Okay, so thank you all for joining us tonight. Please share with your friends and family who may be other lay caregivers within these facilities. We are going to plan to keep these modules available, and if you can, join us next Tuesday for the third module and the final module.
Thank you, everyone.
Thank you.
Thank you.
Bye.
Bye.
Bye.